For ministers of care, when you've first entered the anteroom here in Feinberg, and you've had the opportunity to place your personal belongings here in your regular location, the new steps for preparing to take Holy Communion to the patients in Feinberg are as follows. We use the sanitizing gel located here on the shelf in a way that you similarly would in visiting patients. Next, we would take a pair of the gloves. Then we would take one of the pyxes from the purified and disinfected pyxes container, come up to the tabernacle, open the tabernacle as you have been in the past, take the gold ciborium labeled hosts for patients, remove the number of hosts which you are likely to need for your visits to the patients, and then close the pyx and the ciborium as you normally would. Also, you would take a second empty pyx with you, again from the purified and disinfected pyxes, so that in the event of a patient dropping the host or regurgitating the host, you would put those soiled hosts in the second pyx and keep them contained in there until you return after your visits. You would then take the regular pyx with the hosts, which you will bring to the patients, place it in the pouches which you have been using, and then go and begin visiting your patients as you normally have. When you finish visiting your patients and you return here to the anteroom in Feinberg, you would set your pyx outside the tabernacle, take one of the purificators from the container labeled clean purificators, you would open up the purificator and place the pyx on it. If you have a pyx which has had regurgitated hosts or hosts which have been dropped, those also may be placed on the purificator as well. Then opening the tabernacle, you will take the silver ciborium, which might be located toward the back, but the silver ciborium labeled leftover hosts. Again, after you have dumped the remaining Eucharist into the silver ciborium labeled leftover hosts, you would return that ciborium to the tabernacle. No longer are we returning any hosts to the host for patients. Whether you distributed them or not, any hosts which you bring back to the anteroom automatically go into the silver ciborium. And then, after closing the tabernacle, we hold the pyx on its side and take a portion of the purificator to wipe the inside and remove any of the small pieces of the Eucharist which remain. You would do this both for the pyx that you used to bring to the patients and for the pyx if you carried any soiled or dropped Eucharist during your visits. You would purify that second pyx in the same way. Then you would take a sanitizing wipe from the lower shelf, using the ones which are provided here in the anteroom rather than the ones that you would find elsewhere in the hospital. Again, these will be provided. Take one of the wipes and wipe both the inside of the pyx as well as the outside, so as to disinfect it. You would then discard the wipe and return the now purified pyxes back to the container labeled purified and disinfected pyxes. You take the purificator, fold it again, and place the now used purificator in the container labeled soiled purificators. And you've now completed the steps for your visit on this day.
Hello! As you can see, this is the Prentice Anteroom, and we're here to just show you where to find all of the items that you will need for this new infection control procedure. The procedure will be exactly the same as Father Matt explained to us when we were in the Feinberg Anteroom. Things are just going to be located a little bit differently. In here, it'll be in these two cabinets above the desk. So the first one we're familiar with because this is where the tabernacle is. And then the second one has the other items that we will now be needing. So you can see that the purified and disinfected pyxes are next to the tabernacle. Just to reiterate what Father Matt had said, is that we're no longer keeping the pyxes inside the tabernacle. So after you purify them and disinfect them, put them back into here. And then taking a peek in the tabernacle, you'll see that we've labeled, just like over in Feinberg, the ciborium. So this one is the ciboria. This one is for the host that you'll be using for the patients. Before you go on your rounds, this is where you'll get the Eucharist. And then when you return, any leftover Eucharist will go into here. So it's really important not to take an excessive amount of Eucharist with you so that we won't be wasting a lot. Maybe take a peek and see how many patients that you have to see, and if you want to take a couple extra in case they have family there, that's fine. You can always break the Eucharist in half. Same things still hold true as far as disinfecting your hands before going into the tabernacle, which I should have just done. And then looking over here, the hospital would like us to put on these gloves before going into the tabernacle. And then we have our clean purificators for when you return and want to purificate your pyx. And then here's where once you're done with that, here's where the soil purificator will go. And these are the disinfectant hand sanitizer wipes that we'll be using to disinfect the pyxes. And then you just return the pyx back to the purified and disinfected pyxes. So I want to thank you so much for taking the time to watch this video. I know it's very tedious and there's a lot of details, and I really apologize. I really wish there was something that I could do to avoid having to have all of this, but to be honest, this is coming down from the hospital and so we're doing the best that we can for the patient care. And so I really appreciate your taking the time to learn the new procedure, and don't feel hesitant to call me if you have questions, or call one of the chaplains because they also will be trained in this procedure. And I will also have a signage out with the steps on there for you to follow. So when you come into the anteroom, you won't feel too overwhelmed. You'll have the steps in front of you, which is the email that I sent. So thank you very much, and God bless you in your ministry.